Hi, my name is Taylor McCraney-Videcovich, and I'm going to talk to you about healthcare system changes we can make as healthcare workers. There are several changes I would like to make to the system. I mean, this is not a perfect system by all means. Healthcare system is not perfect. So there are many changes that can be done. And I believe us healthcare workers, if we put in the effort and the care that we give to our patients to the system, that we can leave this system better than when we found it. A main change I would want to focus on today is the staffing in assisted living, long-term healthcare facilities, rehabilitation places, and stuff like that. I work in the ER, and we see a lot of the patients come from there with horrible bed sores from neglect. Something we've been seeing a lot lately is patients at rehab centers and long-term care facilities being overdosed on painkillers. So not safe practices over there. And one of their big issues in those places is that they are understaffed. And I understand that. It is not efficient to work with not enough certified and qualified people that can truly give resources. So another situation we ran into was there was a patient who fell at their assisted living, and apparently on Sundays, all healthcare personnel, they leave the facility at 12. So they leave at lunch. So there are only people that help them with ADLs like cooking and coloring and eating. But if they fall, they are not allowed to touch them. They are not allowed to provide any life-saving measures. They're not allowed to touch the patient. So EMS had to come in there after no one touched the patient for 10 minutes before EMS could get there, and they picked the patient up off the ground, and it was just a horrible situation because they could have been stabilized. But if the healthcare workers weren't sent home at 12 and they had full staffing, maybe that would not have happened. But there are many barriers to this being able these changes to be implemented. So one is, where would we find the people? And two would be, where would we find the funding for said staff to be hired, or for them to be qualified for you to certify the staff that you have? So where would we find the people? I say, let's inform the public, inform nursing school students, inform nurses that the truth to what's going on within these places, the neglect that's coming on to these patients, the med errors that are happening, the amount of unqualified people that are working in these places that can't help these patients if they are hurt. I think that would encourage more people to come into this area of healthcare, and where we would find funding or ability to certify staff. So I was certified and licensed as a CNA in high school. We partnered with a community college, and we partnered with the local hospital, and for the benefit of the public, it was better for them also. We did some hours there at the hospital that they paid for us to get our license and get certified. I believe that healthcare facilities like assisted living, long-term health, and rehab centers could go through something like that to get maybe all personnel working in these places, even if they do work in the office, to be certified to at least provide life-sustaining measures. The world needs to shine a light on the reality of these places and how you or a loved one is eventually going to make it to these places. The change theory that I decided to use is complex adaptive systems approach to change, and you can see it throughout this, but it's something I truly believe in. Thank you.